Hi, I hope everyone is staying safe at home. We all know that Malaysia is now currently experiencing our third wave of the COVID pandemic, and we are all under lockdown once again. I understand that this is a very trying time for all Malaysians, and there are many of us who may feel very down and depressed over the last few weeks and months, understandably so, given the current situation with our economy, and the fact that you're under lockdown. There's a lot of uncertainty in both in terms of our health and economic future. So I think it's important to address this issue of depression, and here are a few tips that we should consider in terms of trying to reduce or prevent depression in daily lives. I think it's important, for example, to have a purpose. If you're working from home, or even if you are not doing much in terms of job-wise, you should have at least a project or a new activity. Perhaps pick up a skill set, a new skill or hobby during your time at home. I think it's important to focus, spend time rather than just idle away with doing nothing. I think that's important to have a sense of purpose at home. The other thing I think is also important is to have a degree of normalcy, meaning that even though you're under lockdown, it doesn't mean that you just no routine and just sleep all day at home. You know people who, for example, during the lockdown period, who wake up, hang around the house in their PJs or pajamas all day long. I think all that basically would not be very healthy for both your mental and physical health. I think it's important, for example, to have normalcy and a routine so that you actually get changed, wash, wake up at the usual time. And if you're working from home, make sure you have designated areas where you can do your work and certain areas where you can play. So you do separate out all your daily routines to fixed regimen. And this will also help later on, and it will help you to adjust when you return back to work when the lockdown period is lifted. I think that's important to help counter some of the symptoms of depression and isolation that you may feel. The other issue, of course, the effect of isolation itself. I think even though you're under lockdown, does not mean that you have to isolate yourself from the rest of society. I think it's important that you can take this opportunity to still keep in touch with your friends and relatives. Nowadays, there's a variety of technology through the phone, through video conferencing, through Zooming, FaceTime, where you can still keep in touch with your family members and loved ones. The other thing, of course, is also important to maintain a healthy lifestyle. Sometimes it can be tough, but when you are depressed especially, you might be more prone towards comfort foods and things like this, which are high in caffeine. It's not healthy. I think it's more important to take foods which are healthier, that might put you in a positive moods, for example, antioxidants and omega fish oil, and which tends to boost your morale more than these comfort food do. Food like alcohol and all that, when the effects wear off, do actually enhance depression. So I think it's important that even during this lockdown period to maintain a healthy lifestyle. And the final point I think is important, especially for those with heart disease, is that they need to maintain and not neglect their health, especially their heart health. For example, if you're feeling down, isolated, and just because you're under lockdown does not mean that you do not take your medications. It does not mean that you have to miss your doctor's appointment. If you have a medical condition, I think it's equally important to maintain those appointments, to see your doctors, because the COVID itself, I've said this before and time again, that the mortality rates from the COVID infection is low, and therefore it should not be a deterrent for you for not seeing a doctor. For example, are suffering heart symptoms, and if you delay treatment, that is potentially more serious, the cause of the COVID infection. Finally, if you feel that the depression is still overwhelming despite taking on these measures, then it may be a good idea to see someone, to see a specialist or to seek help with a therapist. There are plenty of people out there who can help, and they are professional that you can get, and I think it's useful, especially during these troubling times, seek professional help if you find that you have no one else to turn to. In summary, depression is a major risk factor, not unlike hypertension, diabetes, stress, high blood pressure, depression, all major risk factors for heart disease. And patients with depression are at higher risk of developing cardiovascular complications. And patients with heart conditions with depression are even higher risk and have poorer outcomes. Hence, if you are a heart patient, I would urge you not to forget or neglect your heart health. I think that's a very important point. And for many patients who are depressed, I think it's important to recognize that too, that they do need to seek help if necessary. Well, thank you for watching. I hope you liked the video. If you do, please don't forget to like, share, and comment.